Good night. I'm Carlton Stiff, and tonight I'm going to do a presentation which includes explaining 5 medication, and in that we have to explain the indication, the contraindication, the route, side effect, and the dosage. Okay, so the first one is nitroglycerin. And the indication for that is to prevent chest pain. Alright? The contraindication for that is patients that have allergic symptom to the medication. And the route is under the tongue or between the cheeks. And the side effect for the nitroglycerin is vomiting, rash, weakness, and headache. Alright, and the dosage for that for nitroglycerin is 0.3 or 0.4 milligrams. Okay, so we're going to move on to oxygen. And the indication for oxygen is patient who is in a respiratory distress for the oxygen. And the contraindication for that is patient with COPD or have a lungs disease. The side effect is a dry or bloody nose. The route is via non-rebreather mask or nasal canal. And the dosage 1 to 6 liters or 12 to 7 liters per minute. Then we're going to move on to the oral glucose. And the oral glucose indication for the oral glucose is hypoglycemia. That is when the blood sugar is low. And the contradiction in that is patient is unresponsive, cannot swallow, or has no gag reflex. Alright, and the route for that is the cheek or under the tongue. The dosage for that is 15 grams to 45 grams. Alright, then we're going to move on to the EpiPen. And the EpiPen is for patients who have a severe allergy reaction. And the contraindication is a patient in shock. And the side effects and the side effect for that is vomiting, dizziness, nausea, difficulty breathing. And the EpiPen, and for the route for the EpiPen is an injection under the skin or into the muscle of the upper thigh. Okay, and the dosage for that is 0.5 milligram for adult, and children is 0.3 milligram. Okay, then we move on to final one is aspirin. Alright, for aspirin and the indication for aspirin is lower the risk of a heart attack, stroke, or blood clot. Alright, and the contra indication is that if the risk of bleeding is increased, and the side effect for aspirin is rash, difficulty breathing, and allergy reaction, and the route is oral intravenous, and you have another one is oral intravenous, and then you have the dosage is 300 to 650 milligram every 4 to 6 hours. Every 4 to 6 hours. Okay, and that is my presentation on the 5 meditations. Thank you.